welcome to Rebuilding Self Esteem After Trauma. This is the first workshop of our Survivor SKILLSHARE. We are members from HATIWG Philadelphia, our Healing and Trauma-Informed Working Group. Our goal is transformative justice surrounding interpersonal violence and beyond. My name is Eeden Shale, artist practitioner of Sacred Canvas. My pronouns are they, them, and I will be moderating this workshop today for our facilitators.
Hi everyone, my name is Dr. Rachel Oristano and I am in Philadelphia, which is Lenape land. My pronouns are she, hers, and my field is Chinese medicine specializing in mental health, and I'm happy to be here with y'all.
Hey y'all, my name is Renée Gavitt. I am a member of HATIWG, a clinical social worker, and currently I'm working as a therapist serving folks who have experienced domestic violence. I also want to introduce Amit. This is my puppy, and he will cause interruptions during this presentation, so apologies.
Hi, my name is Lauren Ladner. I'm going to be tech support behind the scenes, so after a minute my video and audio will be off. I'm a member of HATIWGPhilly. I do social media and work on the website and all that jazz. All right.
Great, let's get started. So the first question that we have for our facilitators is, who is this workshop for?
Cool. So I'll start off with this question. Essentially, this workshop is for anyone who is interested in this question and this concept of rebuilding self-esteem after trauma. However, we did want to make it clear that this workshop is assuming some basic knowledge of trauma. So how trauma is defined, how it manifests in the body, symptoms, what happens when someone is triggered or re-traumatized, and beyond that. What do you need? Here, come a little bit. We also wanted to specify that we are not talking about trauma broadly, we're talking about a few specific types of trauma. So this workshop will mention interpersonal trauma, developmental trauma, and complex PTSD. And that's to say that some forms of trauma, such as experiencing a natural disaster, or if you were the victim of a one-time violent experience, such as a hit and run, those things could impact self-esteem. But most likely in a different way than the other types of trauma, relational traumas that we mentioned earlier. So, yeah, I don't know if you have anything else to add to that, Rachel.
Just our little disclaimer here that this is a supplementary tool, this workshop, and we always recommend that you seek professional or community guidance, and we'll talk some more about community care as well. And we're happy to be here for you today.
So next question for our facilitators is, what different ways can people and their self-esteem be impacted by trauma?
Cool, I can start this one off. So, there are many different ways that the various types of trauma could impact self-esteem. We're going to discuss just a few. One that I'll start off with is the feeling of control that often someone who has survived trauma will take upon themselves. Often seen as self-blame, and self-blame can cause lower self-esteem because you're constantly asking, why did I allow this to happen? What's wrong with me that I put myself in this situation? And actually, this starts out as an adaptive coping mechanism. So in taking control of what happened, you are giving yourself accountability and saying, like, I can perhaps change something the next time. And in so, you are not acknowledging the sometimes really scary truth that the world is a place where dangerous things can happen when you did nothing to invite that. However, it stops becoming adaptive because the impact on self-esteem lingers long after the traumatic experience or repeated traumatic experiences happen. So that's one way that experiencing a trauma can impact self-esteem, is taking on that control or self-blame.
And then with regard to, especially since we are focusing a lot on trauma from interpersonal violence and things like that, a lot of that coping mechanism can look like internalizing the messages from the abusers. So that voice that is telling you these negative things about yourself may not have fully come from you. It may have been things that were said to you over a period of time by your abuser, or things that were implied through their behavior, including self-esteem issues around finances. Like, for example, maybe your abuser didn't let you control your own finances, right? And so you have come to a place where you don't trust yourself around your finances or around money as well, because you were basically told that you are not trustworthy, which is not true, of course, but that's what has been repeated to you in this abusive manner. And so you've possibly internalized and have this like low self-esteem around finances. So it takes time to figure out, first of all, that isn't you, that voice isn't you, and then also, okay, so if that's not the truth, if that's not my truth, then what?
Yeah, that's an excellent point, Rachel. And I think internalizing messages of the abuser and anyone throughout your life. So oftentimes you might not even realize that the negative self-talk you have in your head is coming from things that your caregivers or family members or a teacher or folks in your childhood, and you might not even remember the specific instance of them saying these things, but it has become part of the way you identify with yourself. So yeah, any toxic relationships throughout your life. And did I have anything else to say about that? Oh, yes, I did. So not only actual people saying these things to you in terms of relationships, but also just overall messages from society about specific identities you might hold. And that can, of course, come from media representations or, all around.
Yeah. I actually have like a small anecdote, if you don't mind, I can share. So I have a friend who is American Indian descent, and she grew up in this neighborhood that was all white. So she was the only brown person in an all white neighborhood. And she grew up very insecure about her appearance because all of her friends were these white girls with blonde hair, and she was the only person of color in her community and amongst her friend group, and didn't think that she looked like she didn't like the way she looked because of this. And I asked her if she'd been bullied at all, and she said no, actually, like everyone treated her really well. She never got anyone saying mean things about her culture or her appearance or anything like that. It was just the fact of being the only person who looked the way she did in a group of people who looked different from her, with lack of media representation, all of that led to this low self-esteem about her appearance. So this is, a situation where nobody told her anything overt. So imagine how, and then it's still powerful that she was the only one, that she was isolated in this way. So imagine how much more difficult it is if, on top of that, yes, you are specifically receiving insults and you are specifically receiving messages directed toward you that you are not worthy because of XYZ thing as a marginalized person.
Absolutely. And I think I'll just add one more note to this question of how trauma can manifest in issues with self-esteem, and say that a lot of going through trauma is unrecognized grief work. There is grief in the fact that this trauma or repeated traumas happen to you without you doing anything to invite it, or without your consent. And so Kubler-Ross has these 5 stages of grief, and it is limiting, and but just as a starting point, there are different stages, there are different emotions that come up, and a lot of times people can kind of feel stuck in that stage and not understand that it is grief work. So whether it's holding on to anger, whether it's bargaining and asking why, or what else could have happened, whether it's just depression, sometimes it is just acknowledging and accepting that this awful thing happened to you, and going through that grieving and figuring out the work that needs to be done to still go on living, which is hopefully what we want to address in this workshop.
Yes, and also we're going to go in soon about talking about, finding those resources, but I can't ever, let a conversation go by without talking about spiritual bypass, because it's one of the things that I like to rant about on end. And so, let's say you've come out of this abusive relationship and you're looking for healing, and yet a lot of the messages that are put out by the greater wellness community or by individuals that are not ready to be supportive in the way that you need support can be dismissive, right? And so you may have reached out and not received the support you needed, and that can layer on to your self-esteem issues as well. So, ideas like the law of attraction can be very beneficial to some people in their healing, but if it's weaponized in such a way that it makes you feel like you attracted this negative experience, and that can layer on and add to your harm, right? And add to this self-esteem, these issues in self-esteem that occur after trauma, after interpersonal violence, and so on. So that's another issue around this, is the stigma and the lack of proper support from individuals or from the greater community at large.
Thank you both so much. We also want to acknowledge that the process of undoing these impacts of trauma are going to be different for every single person. So there is no one size fits all, and be patient with yourself as you figure out what is truly helpful for you. Next question: how to find the right therapist, community, or support system for the healing process?
I can kick this off. So there are a lot of options. That's one of the great things, is that there are a lot of different directions in which you can take your healing and look for support. And what works for you might be different than what works for someone else. But you can definitely find what you need. And one of the things to keep in mind is that, especially if you're looking for like a therapist specifically, is that it can take some trial and error, right? It can take some time to find the right fit. It's okay if the first person doesn't work out. That doesn't mean that therapy doesn't work, it means that that person might not have been right for you. So that's important to keep in mind. Word of mouth is always great, especially if you're in a small community, especially if you're in a marginalized community. That can be really helpful to find someone who understands your specific situation that you feel comfortable and safer with in the office. And then when it comes to community support, something that's important to remember is that our communities and our friends, we usually have more than one, right? We usually have a few different circles that we orbit within, and you might find that your friend group that is really great for going hiking or for hanging out or going to the movies or whatever that kind of activity is that you grew up with and maybe you experienced before and during this situation of interpersonal violence. This group, while you love them, might not be exactly the community that you need support-wise for this stage in your healing. You might also need to start seeking out other survivors, other people who have gone through what you're going through, who are willing and able to give you the support that you need. And it doesn't mean that the original friend group is that you need to leave that friend group. It just might mean that that's not where you need to go for this different kind of support.
Okay, so yeah, Rachel, on that note of finding community and the importance in friendships and community to support you in your healing, I would suggest to folks to kind of think through a lot of your friendships and evaluate the nature of them and whether you find yourself in a caretaking role for certain friends, and kind of asking why that is this benefiting me? Finding if you have certain friends who maybe offer you support or praise and you tend to shy away from them. If there are people who don't make you feel that great about yourself, but you keep going back to them. And those are just various forms of interactions that can happen after trauma when your self-esteem is lower. So becoming a caretaker as a way to not deal with your own issues and kind of still have that good feeling of helping other people. So again, not to say that it's, a negative thing, but can be detrimental in the long run. Or feeling like folks who are actually really supportive, noticing that might overwhelm you because you're not ready to hear that or accept that. And also just repeating patterns and gravitating towards folks who, while they might not make you feel that great, it's a feeling that is familiar. So reevaluating certain friendships and we can talk more in the solutions part about continuing on finding supportive communities, and Rachel already addressed that. And also I just wanted to emphasize that although we are going to talk about some work that you can do on your own, whether it's just through replacing thoughts or journal exercises or whatever it may be, that healing relational and developmental trauma does happen through relationships.
Thank
So
you.
corrective emotional experiences are really important, whether that's through work with a therapist, loving friends, supportive partner. It's necessary in addition to self-work.
And also, with respect to what Renee, what you're talking about regarding looking through your friendships and your relationships and seeing what those interactions are like and what type of roles you fall into, this is also a good time to start thinking about boundaries, which is also something that I always have to talk about. And so one of the things that can come up with low self-esteem after trauma is that you have a little bit more trouble establishing boundaries in relationships. And that makes perfect sense because you've just, had this interpersonal violence or other similar situation where your boundaries have not been respected, and you might have had to, like we mentioned earlier, take some adaptive coping mechanisms of fawning or similar in order to survive, essentially. And so your ability to establish boundaries and feel confident doing that, and to feel that they're going to be respected, right, is diminished. So relearning how to set boundaries, identifying people that respect them when you do set them and that encourage you to set them, even better, that can even help you rebuild your self-esteem, because if you start to set one little things here and there, and there's, of course, everyone go at their own pace, but maybe a little experimental thing, and someone respects it, that moment right there can really be empowering and help you reaffirm your sense of self and sense of self-worth.
Fabulous. I'm going to briefly go over some other points in notes. So tools also need to be repeated. It is a process, not an event of recovery. It'll get easier with practice and requires consistent application. Also, there are alternative or spiritual tools for confirmation and confidence. You can really ritualize self-care and nurturing yourself as you begin to figure out what helps and what hurts, or what may or may not work for you. Some examples could be tarot cards or runes as guidance. Also, meditation can really help when we're dealing with isolation and the like. And really tuning in with your internal guidance system to help navigate social landscapes. Next question. Which solutions are worth considering for rebuilding self-esteem?
So I can start off by talking about negative self-talk, which we've mentioned a few times in this workshop so far. And I would say the first thing is to just recognize when you're doing it and that it is a thing. I think for a lot of folks, it's so normalized that they're not even hearing themselves kind of like berating themselves over and over, or there's the assumption that this is just how everybody interacts with themselves when they feel like they're making a mistake, or they're not feeling the best way. So yeah, step one is just becoming aware of the way you talk to yourself. Beyond that, we have a few different ways to work through this. So another thing we talked about is trying to identify where the voice is coming from. Oftentimes it's coming from, as we said earlier, a former abuser or a toxic early childhood experience, or messages from society that have become internalized. So doing a process of distancing this voice that is you to identifying where it comes from. In order to try and decrease the amount of negative self-talk you engage with, there's a few different ways. One thing that works for some folks is affirmations. And so turning negative self-talk into more positive sentiments and going through a process of replacing the negative to positive. As I said, it works for some folks. So sometimes just saying the opposite can be really powerful, and saying it over and over again. For example, if you have low self-esteem about the way you look. I've worked with a client who just had "you are beautiful" written on her mirror, and every time she looked in the mirror, she saw that. And it seemed really powerful and helpful for her. And it was, I won't say it was enough. There was other work she was engaging in, we were engaging in, but it was definitely helpful in the process. For other folks to just replace something with the opposite, it feels not real or not enough. So if you are saying to yourself, I'm disgusting, I look horrible, and then you just say to yourself, no, I'm beautiful, you might further engage in this eye-rolling process of like, this isn't working, I don't believe that. So another thing to try with this is, instead of an affirmation, you can use kind of like a mantra to work up to that you do believe is true. So let's say the negative self-thought is, nobody likes me. And you try replacing it with the positive of, I have friends and family who love me, but that's not working because you just really don't believe that. Think of something that feels true that you can work up to, such as, I deserve to be treated with love and respect. If you believe that, even if you aren't there yet, but you think like, I can engage in behaviors or in relationships that can bring that about, it's something to kind of keep in the back of your mind and to replace it with. One example of someone I worked with, we kind of did mantras together, and she came up with one that was, I am worthy of love that doesn't come at a cost. She was used to feeling like she needed to do a lot for other people in order to receive the positive attention that she wanted. So when she wrote that, like, she was still engaging in that behavior of really trying to please people and create scenarios where she felt like, okay, now I'm worthy of this love. But she also knew she had the goal of getting to the point where she didn't have to do that. So that felt real for her, and that was powerful in helping her get to that step. Okay. Well, that was a rant. Sorry.
It's okay, we'll just rant back and forth. We've got a whole lot on this section to talk about, so buckle up, everyone. So one of the things I wanted to add to what you said, Renee, about bridging that gap between the implanted low self-esteem thoughts in your head to thoughts of, positive thoughts, and flipping that. A little trick that I like to kind of get you started in that direction is to start identifying objective, as much as possible, situations where someone has said something nice to you or about you that made you feel good, right? So it's not so much about that idea of I deserve to be loved or I'm worthy of this, et cetera, et cetera. That might not be where you're at right now, and that's okay. But instead, if your friend told you they loved you, or your someone said they were proud of you, or said that they really appreciated this particular skill that you have, or thought that your eyeliner was really snazzy that day, or whatever really lovely thing that was said to you that made you feel good, and you can write down or think about, like, objectively, they said this, they said these words, it is true that they said these words. And then later, as you start to sit in that space and collect these concrete examples of people treating you well, then that can start to translate into, oh, I deserve to hear these things. I deserve to be treated with love and affection. I deserve to be praised for my skills because it's true. And it can help you get from one point to another. And that's why the previous question we discussed about finding a community, that's why that's so key, right? Because, while the inner individual work is absolutely crucial, we are social creatures. We need our interpersonal relationships. We need our attunement with each other. We need this community support. We're not, the bootstrapping thing is a myth. Like, we can't do it on our own. We need all of this. So being able to just take note of all the nice things that have happened to you or that people say to you or about you can help as a really good tool and a good practice, as well as branching into gratitude eventually as well. One of the other things that we discussed, thinking about this negative self-talk, is to personify the negative self-talk, so it helps you identify it when you start thinking of it as something separate from yourself or as a different part. And so we had, Renee and I had discussed a few different styles of therapy that you can look for and consider as ways that are useful for coping with this. One of them is called internal family systems, and this is not a family therapy. This is the internal family within you. So these are the systems of parts, and the idea that when you go through certain experiences in your life, your mind creates a different part that is different from your true self, and it has a specific role to play in your adaptability and your coping. And these parts come up because you needed them. There's no bad part. So there's no bad part of yourself. We'll just start with that. And in internal family systems, it does have this particular structure, which if you are a person who gravitates toward structure and toward categories of things, then this might be more beneficial to you. If not, I think Renee is going to touch on a different style that's a little bit broader. But just to summarize, internal family systems describes the parts as either managers, which are kind of your conscious functioning day to day, and just kind of getting you through different things. Your exiles, which are the pieces that are more likely created due to trauma, and they protect you by keeping you from having to re-experience the thing that you went through and are a little bit more hidden. And then firefighters, which is a different coping mechanism, those are your distractions. Those are things that can help prevent you from feeling the pain that the exile is feeling, and they can manifest as redirection toward other coping mechanisms like sex or overwork or exercise or food or et cetera, et cetera. So when you do this work, you start to identify these different parts and how they've served you and where they've come from and how to talk to them and eventually, hopefully, like kind of re-assimilate them into the self, so that you become more familiar. So when you hear this negative self-talk, that might be like a part that was created through this experience of trauma, and then you can talk to it, right? And so instead of it being like your own negative self-talk, you're having this conversation with this personified different element of yourself, and it can be a little bit friendlier in a way, and a little bit more accessible, and a little bit less draining.
Yes. So going off of internal family systems, a similar modality of therapy, generally termed as parts work, has the same concept of first acknowledging that we have many different versions of ourselves inside of ourselves. And sometimes you are you and simultaneously not you. And oftentimes when we're engaging in negative self-talk or feeling in a state of really low self-esteem, whatever the issue is becomes the whole of us. We forget that we have all of these other great assets and versions of ourselves, and it feels like you are your anxiety, you are your trauma. So with parts work, there is the normal going on with life part of self, and then there is the traumatized and often child selves that come out in different circumstances. And maybe you've even recognized this before, where I know for me, for example, like when I visit my family, sometimes I feel like I am my 14-year-old self again. Or, if you are in a situation where you're experiencing social anxiety. You might, like, I feel like I am like a child at the playground or something. Like, oftentimes we have this body memory of when these feelings started to arise. And so when I talked about this workshop presuming some knowledge of trauma already, this part, so we know that fight, flight, freeze, submit, or fawn, different cells, and sometimes people misunderstand it like, oh, when I feel re-traumatized, my reaction is always fight. Often we have all of these cells in us that have all come out at different times. So, and they are often attached to different ages and different experiences. So doing this work is a process of identifying all the different cells, their trauma reactions, and then talking to them as your normal going on with self, daily functioning you, talking to the other parts of you that are in flight stage, so they are using lots of substances to not deal with traumatic memories, or the fight self that you have that is lashing out at people, and then getting angry at yourself because you lashed out at people. And something I've noticed a lot in working with folks with low self-esteem is that they tend to have incredible compassion for other people and often really want to help others, yet it's so hard for them to turn that compassion towards themselves. And so this process can really help by saying, like, this part of you that's coming up right now is this 9-year-old that needed a protective adult and didn't have one. Like, can you now be that protective adult and talk to that 9-year-old version of yourself and offer these words? So that can be really healing. And one more quick thing, another form, kind of that all of this is related to, is narrative therapy. So what we're talking about, in a sense, is externalizing. So we're talking about externalizing different versions of yourself, but you can also engage in the process of externalizing the issue. So I brought up like anxiety before. Instead of thinking like, I'm so anxious, I can't do this, I can never go out in public, I can never get through this task because my anxiety flares up, you can externalize it as the anxiety. It is not all of you. You are not your anxiety. The anxiety is an issue. And I actually heard this done just yesterday on a podcast talking about this person who has a stutter, and he externalized that and said, it comes out in conversation. And so really it's the stutter that is the issue, because someone else is engaging in conversation with him, and this process is something that they both have to work around and deal with. And that was like an example of it that I just loved. So yeah, narrative therapy is externalizing the issue and then eventually engaging in the process of rewriting your narrative.
And then another therapy that we've actually, a lot of these concepts kind of overlap with each other, because ultimately when it comes to therapeutic modalities and orientations, the main thing that's important is really the rapport with you and the therapist or counselor or what have you, right? But then things that work tend to repeat themselves in a lot of these modalities, which is why you'll see some similarities, but then like the little things that are different are more on the individual level, right? This thing might work for you versus, IFS versus parts, or vice versa. But with that in mind, I want to bring us into dialectical behavior therapy, which is my personal favorite. I'm not biased at all, right? This is the thing that I got certified in that got me really back into being really passionate about mental health. And one of the elements about it is that it has this really nice bridging quality. Like a lot of what we're talking about is how you can't go from, you know, freshly traumatized to immediately perfectly like not. There's all these gray areas that we have to play with, and healing is not a straight line. It's not linear. It's going to have all of these dips, and it's also like a lifelong process. And so DBT is a style of therapy that is very heavily tool based. So it has all of these different techniques and things that you can try that build on each other, that you can always access after you learn them. And one of the concepts that's really important is this concept of radical acceptance and non-judgment. And I want to be very clear about this because I'm always trying to be very clear because I had a not so great therapist who wasn't very clear and it did not work for me. So let me be clear that radical acceptance is not complacency. Okay? Radical acceptance is not complacency. It's not about giving up. It's not about being like, all right, I guess this is just the way things are and I may as well, you know, not. It's about recognizing where you are and accepting where you are so that you can then identify the steps you need to take to get to where you want to be. So the metaphor that I like to use is travel. So I'm here, I'm living in Philadelphia. If I want to drive to New York City, I can't drive to New York City if I am in denial about that fact that I'm living in Philadelphia. If I think that I'm in Ottawa, Canada, I can't get to New York because I won't be driving the right way. So I have to accept first that I am in this specific location in order to get to the next location. And then in doing so, one of the important things about radical acceptance is this space of curiosity, open, compassionate curiosity and observation, as opposed to judgment. So when you start identifying this negative self-talk and these feelings of low self-esteem, taking yourself out of it a little bit and looking at it as if it's a new thing and asking, okay, so where does this come from? This is an interesting thought that I've noticed coming through my head a few times. I wonder if there's a specific trigger that's causing this thought, or I wonder if it's because I'm hungry, and when I'm hungry, it brings me to the space when I didn't have enough to eat, and therefore I'm kind of reliving that same emotional state, and suddenly I'm having that same kind of thought. There are a lot of different things that come up in this trauma work that can give us the information we need to move forward, but we have to be in this space of non-judgment and disengaging from this internal judge in order to observe it. And then once we observe it, then we can figure out, okay, how can I negotiate with these thoughts? How can I talk to these different parts of myself and try to move forward in a different way? How can I seek out different coping mechanisms, because the ones that I had were really great and they served me and I needed them, and now that I'm in a different situation, I need a different set of coping mechanisms, right? So that's a big portion of DBT, and along with his acceptance is this both and technique that is really important, where you recognize that two things that can feel like they're in opposition are actually somewhat complementary and true. It can look like recognizing both the kind of so-called logical objective circumstance and also honoring your emotional state, right? So you can say, so coming back to that tool I spoke on before of, you know, writing down nice things that people have said to you or observing that, a both and statement might look like, my friend said this specific thing to me, and I, in this moment, do not feel like I deserve it because of what has happened to me. However, and I also recognize that my friend believes that I do, and that has meaning as well, right? So that's a bit of a complex one, but that's one of the ways that we can use these tools. And I will pause and let Renee come in, because I could talk about DBT all day, every day.
Everything was great and super helpful. Yeah, so I think we have named different modalities that, take a time to work through and are best done with a practitioner, but also wanted to name specific tools from them to like take away from this workshop and start putting into practice. One last thing that I want to mention, and something you can do on your own right after this, especially if your low self-esteem doesn't feel as clear cut as like I have body image issues, or I feel, I'm trying not to use the same example, anxiety, whatever it may be. It sometimes it doesn't feel like it's just one thing, or it's all over the place, and you just feel bad. You don't feel good about yourself. So I'm going to describe briefly kind of writing exercise you can do to start to untangle all of that. And it's still kind of going along with all of the parts work we're talking about. So try and be like concise, but not so concise that you don't understand it. Okay, so step one, you will list all of the various identities you hold. And this will take a minute to try and like pull from everywhere and think about it. And I'm sure there's lists online or something, but so you want to talk about race, gender identity, sexual orientation, immigration status, and then anything that's relevant to you. It could be relationship status, or different roles you serve, such as like you might be a mother or an aunt or a father, and you can include anything that feels relevant. If your job feels like part of your identity, if your astrological sign feels like part of your identity,
Yep.
being a survivor might be a huge part of your identity. Any health issues, diagnoses you carry, et cetera, et cetera. So step one is like listing as many as you can think of. Step two would be to create some sort of shape and map these out, whether it's a circle and it's a pie chart. I've done it inside of a heart, a blob, whatever. And you want to figure out where you're at this time and how much space each identity takes up. And so knowing that changes, right? And I can think of something to share, an example from my life. So having a learning disability is one of my identities. When I was working in outdoor education and wilderness therapy, that portion of my identity was like minuscule, like hardly factored in, never thought about it. When I was in college and grad school, at times it felt like it was like the hugest piece of who I am. So these identities will shift depending where you're at. Next up, think through each identity, and you can label whether this identity feels like it is a targeted identity to hold, or any other words that feel right for you, whether that's oppressed or marginalized, or is this identity advantaged? Is it privileged? Is it neither? Is it both? Kind of list through that. And then with the ones that seem relevant to explore, so, if you're like, okay, my astrological sign it's just good. I don't need to think through all of the experiences I've had with that. Like, some of them you could just kind of leave out. But the ones that feel really targeted or oppressed, and the ones that feel super advantaged, you want to list through all of the messages that you've received about this identity, whether you think they're coming from you, whether people have talked to you about it, whether it's coming from society as a whole, and start to untangle where all of these messages are coming from and how it factors into your identity as a whole and your perception of yourself. The goal in this being that a lot of these identities that feel oppressed and targeted can simultaneously hold the space of being a source of pride and enjoyment. You can find growth, community, self-worth in holding this identity. And so 2 books that I would recommend after doing this exercise, if it feels relevant, would be Sonia Renee Taylor, The Body is Not an Apology, and Bell Hook's Marginality as a Site of Resistance. We'll probably come up with some more things for us.
And I want to also bring the solutions and coping mechanisms back to community again, and give you a tool you can use amongst your community and your friend groups that you feel are helpful to you in your healing journey. So, and I'll give an anecdote, an example. So, a friend of mine who had gone through a very significantly emotionally abusive relationship and had been in it for at least 5 years, something like that. After coming out of it, even many years later, when she was in healthier relationships, more loving relationships, and so on, struggles with doubting her own reality, because a lot of the harm that was done to her was around gaslighting, right? And so gaslighting is when someone systematically, frequently makes you doubt your own reality, and it can be really harmful to your self-esteem. So, and your ability to recognize your own emotional responses to things too. And so she also would get into this space of automatically trying to placate, which is also very common in that kind of circumstance, where she was used to placating her abuser to try and do what she could to survive in that situation. And so that's kind of a role that she falls into pretty easily. And so there was a situation where she received some messages from another person that I knew, and these messages made my friend like not feel good, and she wasn't sure if it was her own perception or if this other person had actually been being rude to her or cruel to her in some way. And so what she did was she came to me and my other friends and said, "Hey, I can't tell if I'm reading too much into things, or if there's nothing there, or if this person is actually like being dismissive of my boundaries in this situation. I don't know what's happening here. Can you all take a look at this and try and give me your opinion on it?" And so because, we are the kinds of friends that we are compassionate and we are honest, right? We will, we come from this place of love, and also if we'll tell it like it is too, because we're not yes men. So that's like a really good balance to strike for this kind of situation. And so we're able to look at this message and be like, yeah, so your instinct is correct. So no need to doubt yourself. And this is, the way in which this person is responding and why it's harmful. And here's how the way that you're feeling was correct in our view. And so being able to have that support network where you can actively reach out and say, I am having this feeling and I'm doubting myself because of this thing that I went through. Can I talk this through with you? Can I get an opinion from a good supportive friend? And that's something that we can all do. It's community-based, it's network-based, and it's a really important thing to remember that we can reach out to each other that way, and we should reach out to each other that way.
Cool. And I'll just add a few quick little things. sometimes when you're feeling really bad and you don't have the time or resources in that moment to kind of engage in this long process of figuring it out, or even the replacement of thoughts, figuring out really quick remedies to just ease that feeling in the moment. Whether it's having like essential oils or a certain scent, or anything sensory that's going to instantly kind of bring this feeling of relief. I know in DBT they like to use like ice cubes, or like soaking your face in water, or anything that's going to like change your emotional state rapidly without the process of really engaging in your feelings or figuring out, like, going through the whole process. Like, you just need a quick calm down, return, become grounded, and possibly then work through it, or like later when you're feeling up to it. Even changing location. Like, for me, going on walks is super helpful. If I'm sitting in a place, I can much easier like ruminate on something, but if I'm walking and thinking through it, I just like feel completely different. And the process of thought blocking. So again, if you find you're ruminating on a thought or like engaging in cycles, to just interrupt yourself and say, like, I'm not going to think about that right now. Or anytime you start to think about a certain thing, you're like, I am going to put up the image of my sweet baby Onyx, my dog. Like, it's something that's like, quick, engage in this thing. And Eden, I believe you have a meditation based around that.
So we are going to do a brief thought releasing meditation. When replacing thoughts doesn't feel helpful, or when we have really intrusive thoughts, this can be a wonderful tool. I don't recommend using it for intentional repression, but more so to ease yourself into a place of centering when we feel like mental violence that can come up as a result of being conditioned from trauma. So if you'll just take a couple deep breaths, you can close your eyes, turn inward, feel your feet on the ground, you can feel them, or on a chair, any of your limbs, maybe feeling your root where you're sitting or laying down, depending how you're watching this, and feeling the wave of your own space that comes into view as you detach from the outside world and focus on your internal sense of self. Find where that center is in your body and use your breath to remain present with it. As you do, begin to visualize TV static. Engulfing the thought or the image that has come into your mind, or your sensory field that feels intrusive, and let that TV static overtake that thought, but not you. Remain centered. Remain within your bubble of safety and watch as the TV static, the little black and white flickers, begin to fade out this thought, this memory, this vision, back into the homeostasis, the openness, and the nothingness around your field. Allow yourself a couple more deep breaths. Take the biggest breath that you've taken all day. You can make some noise on the way out. and slowly come back in your own time. We would like to thank you deeply for watching. We hope that this tool has been restorative. The work that we do is volunteer-based. We do not expect donations. However, if you would like to show some gratitude, we have some links attached for donations plus further information. Please feel free to reach out to us for any questions or further resources. You can find us at www.HATIWGPhilly.com. And Rachel, where can we find you?
So you can find me on my website, waterandbone.com, all spelled out. Or you can find me on Instagram, on Facebook too, but Instagram at dr.oristano, which, can you see my last name here? Is that listed? It's spelled like that. And I believe that, if I'm not mistaken, Eeden, you're planning to send out a document with some of this information too, yes?
Yes, resources will also be added wherever this is posted and made somehow accessible. So thank you again, as well as to the community members who suggested this topic. We will see you next time.
Thank you. Bye, y'all.